Well, this is a video I never thought I would have to make, but here I am. It's 2025. If you guys haven't been paying attention to the news, there's been some outbreaks of measles around the country, particularly in Texas, and unfortunately now in my home state of Kansas. Most of the cases have been isolated to the southwest counties of Kansas, but undoubtedly there's been more cases than the 37 reported. It's also a shocker to me because when I was a medical student, I was told, you'll never see measles, but we want to educate you on it just for the sake of historical purposes. Based on this measles outbreak, many of our patients are increasingly concerned about their immunity, whether they should get vaccinated, a booster, and what is the risk of contracting measles. There's a great deal of nuance to this topic. The guidelines are based on the year of birth and specific risk factors. If you'd like to nerd out all of that, watch till the end of the video where I'll break down some of that stuff and answer some frequently asked questions. For those seeking a straightforward answer and reassurance about their immunity, I suggest all adults check their blood work for titer levels. Specifically, we examine IgG levels for measles to demonstrate the immune system's long-term memory. This could be due to prior vaccine or infection. If the IgG levels are high, a person would be protected. In medical training, whether you're a doctor or nurse, we're required to get titer levels before working in those clinical settings because it's the best way to ensure immunity. It wasn't enough just to have a record of my childhood MMRs. So I think if we are looking for the most reassurance, that's the simple, most straightforward way to get it. This test is pretty easy. It's a blood draw. In our practice, it's only about a $10 test, so it's also not expensive. If you want that reassurance, whether you've had the vaccines or not, let's just get the blood levels and tell you whether you're immune. But what if a person already had the vaccine and they're certain they had 2 doses and have documentation? I think most guidelines would suggest that's okay. We should presume that person is immune, but nothing in biology or medicine is absolutely perfect. In this case, if a person has been vaccinated at the standard schedule as a young child, I think it's about 97% effective against infection, even when exposed, which is really good. And usually we don't have to worry because we don't have measles floating around. But what about the 3% of people who aren't protected by the standard MMR vaccine? This happens for a variety of reasons. It could be due to poor history or records, perhaps a mishandled vaccine, not manufactured correctly, stored, administered, or in some cases, the person's immune system just wasn't triggered enough. Although it's 97% effective, if you're looking for the 100%, the titers is the only way to get that reassurance. Also, in the first 10 years following the introduction of the measles vaccine, these type of failures were more common. So if a person was born between 1957 and 1968, checking a titer level is even more critical. People are also asking us about booster doses. Maybe they've had MMR vaccine, or maybe they had 1 dose, but they're not really sure. So there are some guidelines suggest this is reasonable. And this, if a person isn't certain and they were born between 1957 and 1968, getting a single dose of that definitely makes sense as not harmful. However, it may or may not be necessary. And without those titers, we're not really sure. We have some patients who've never been vaccinated for a variety of reasons. If a person was born after 1957, especially if they lived here in the US, the odds of a natural measles infection and subsequent immunity are extremely low. So I would tell these people, presume you are not immune. If you're older than age 70, guidelines suggest that you don't need to do this because you almost certainly had measles because it was that widespread prior to the introduction of the vaccine. But again, it's always reasonable to check the titer levels. So what do we do if a person doesn't have adequate titer levels and is not immune to the measles? We start the MMR vaccine series, which is a dose of 2 vaccines. If a person's an adult, those can be spread out over a few months. And after a few months, you get up to 97% protection. I think that's the smartest approach. I don't want this measles outbreak to scare anyone, but it's not something I want to deal with in my community. If you want to be protected from measles, talk to your doctor or give us a call and we'll figure out how to help get you those titer levels done and see if you need any additional vaccine to help protect you or your family.